You're watching 22 News in Focus, and today we're talking about how our region is recovering from the COVID-19 pandemic with Dr. Robert Roos, Chief Medical Officer at Mercy Medical Center. There has been conflicting information about a vaccine and treatment for COVID-19. Now, we've heard from health experts that vaccines can take years to develop and test before approval. Chloroquine phosphate or hydrochloroquine sulfate were earlier considered possible medications for treatment and have since been dropped. Medical researchers say it may be another year until we see the virus in true decline. So, Dr. Roos, what has been the best treatment that patients are responding to?
Well, it's an important point to recognize that the FDA has not approved any single medication or treatment for this novel coronavirus or COVID-19. What we've seen to actually be the most effective, and we know this through long histories of working with other types of respiratory illnesses, and particularly a condition called ARDS, or acute respiratory distress syndrome, is that many of the non-medication therapies, like using oxygen with high flow early in the disease, using non-invasive ways to help ventilate patients. And actually in this particular illness, when you treat patients, rotating them so that they lie on their stomachs, it's called proning, have been some of the most successful approaches to helping patients stay off ventilators, stay out of the ICU in some cases, and be discharged from the hospital. In addition to those strategies, there have been some other therapies that have shown promise. At Mercy Medical Center, we feel fortunate that Trinity Health was able to be enrolled as one of a few select systems across the country to use a therapy called convalescent plasma, which is plasma that is donated from somebody who had suffered a COVID infection before and recovered. And using that plasma can help deliver a passive immunity to people with a current infection. So we've seen promise, and we're looking forward to more studies and trials representing the results of that type of work in the future. And in addition, there's a medication called remdesivir, which also has shown promise, that has been utilized throughout hospitals here in Massachusetts as well for patients that are critically ill. And so there's a lot of work and science going into evaluating what the best treatment is. And right now we're looking to continue to innovate and develop the evidence base for that going forward.
Now, have you and your team at Mercy been working with other hospitals and local and state health officials sharing your treatment options?
We have, and that's one of the wonderful things that's come out of a crisis like this is all the hospitals in Western Massachusetts have been collaborating closely, regularly, and very vigorously. Mercy Medical Center has worked with Bay State Health, Holyoke Medical Center, Cooley Dickinson, and even hospitals outside of Hampden and Hampshire counties to ensure that we have similar protocols, to ensure that if we needed to, we would share resources, and to make sure that our approaches to the management of patients are aligned. So we've really been able to bring the best of the best to patient care right here in our community.
And so I want to transition to this. We've been hearing more about schools reopening plans for the fall. What are any of your concerns about children going back to school once the fall comes?
So this is a question that for me is still very much under evaluation. Certainly we know that we need to return to businesses. We certainly know that we need to return to schools. Those are both incredibly important things, not only for our community, but in the case of school, the development both cognitively and socially for our kids. The concerns would just be to ensure that we take these steps appropriately, monitoring and balancing what individual or public health risks may exist, along with the benefits that we get out of those sorts of intellectual and educational interactions. And so it's not so much concerns, but it certainly is there certainly is reason for us, I think, to ensure that we are integrating the proper evidence and taking caution. With kids in particular, as you know, it's much harder. Certainly as a father to a 1-year-old, it's hard to control them and ensure that they're going to physical distance. They certainly can't wear masks, and they may not always articulate their symptoms in the same way that an adult would be. So with kids, I think there are some particularly unique elements that we want to be mindful of when we think about returning to group activities, for example.
And so is access to PPE and testing still a concern for hospitals and other health facilities?
You know, it's not the concern that it once was. Access to the proper protective equipment and testing was something that at a national level, there was a critical shortage early on in the pandemic. At Mercy, we were fortunate to be able to work with the supply chain to make sure that we always had the adequate PPE for our colleagues to keep them safe. And we are, very, very secure in sort of what we have now going forward with the current status. In regards to testing, we know that in order to have a full, universal national program where all the appropriate people in the community can be tested, we would need to increase our testing capacity collectively quite significantly. And so I think it still is worthwhile on a state and on a federal level to continue to advocate for increasing availability of both test kits and test platforms so that all the communities have all the testing resources that they would need. Right here in our local community, we've done a tremendous job in increasing our access, and I believe we are meeting the demands of the community. But as we look to go forward with more businesses and more schools reopening, it is certainly something we need to keep our eye on.
All right, Dr. Roos, thank you for all your insight, and we'll have the last word after the break. You're watching 22 News in Focus.